Welcome to this NCI-AD Data Spotlight. May is Older Americans Month and Mental Health Awareness Month. Older adults experience greater inequality related to social and economic factors, and that can affect mental health. About 12% of adults aged 65 or older report that they rarely or never receive the social and emotional support they need. So what can we learn from NCI-AD about the impact of mental health on older adults? In the 2018-19 survey year, 25% of respondents to the NCI-AD Adult Consumer Survey who are 65 and older reported that they have a chronic psychiatric or a mental health diagnosis. Among those who reported they have a mental health diagnosis, 73% were female. People who reported a mental health diagnosis were younger than those who did not report a diagnosis, an average age of 74 versus 77. A higher proportion of white respondents reported having a mental health diagnosis, while a lower proportion of Black respondents reported a diagnosis. Those with a mental health diagnosis reported poorer experiences with paid staff. Compared to those without a mental health diagnosis, those with the diagnosis were less likely to report that they always feel safe around paid support staff, 71% versus 80%, and that staff always treat them with respect, 84% versus 92%. Compared to those without a mental health diagnosis, those with a diagnosis were more likely to report that staff change too often, 41% versus 34%. Two-thirds of people with a mental health diagnosis reported that the services and supports they receive meet all of their needs and goals. That's compared to 3/4 of those without a mental health diagnosis. Loneliness is a major risk factor for physical and mental illness in later life. Conversely, people who engage in meaningful, productive activities with others tend to live longer, are happier, and have a sense of purpose. Respondents to the Adult Consumer Survey with a mental health diagnosis were more likely than those without to report that they often feel sad or depressed, 27% versus 6%, that they have someone to talk to when they feel sad or depressed, 81% versus 56%, and want to work and/or volunteer. Respondents with a mental health diagnosis were less likely than those without to report that they have family and friends involved in their life and were less satisfied with how much they access their community. These NCI-AD data come from the 6,639 people aged 65 and older across 16 states who took part in the 2018-19 NCI-AD Adult Consumer Survey. To learn more, visit our website, nci-ad.org, or email us with questions.